Hello and welcome. This is Borno Restoration. I am Jesse Tafida. Today on the program, we will track down efforts by Governor Babagana Zulum in improving healthcare delivery to the people of Borno State. This sector is one of the priorities of the Zulum's 10-pact development agenda of the state. But before we track these stories, let's bring you the latest on Borno today. Borno State is the worst hit by Boko Haram insurgency in the northeast region since 2009. Thousands have been killed and millions displaced due to the conflict. But the Zulum administration came in with a 10-pact development agenda which improving the lives of the people is among his priorities.
At the bottom of my heart, I want to express my sincere appreciation to all of you that voted us into another phase of public service. Again, I commit to making sure that we shall work 100% for the benefit of all residents of Borno State, regardless of political, ethnic, and religious persuasions. I want to assure you, the people of Borno State, that the victory you have granted us will neither make us arrogant, nor will it make us to take you for granted.
In the last 100 days of his second term, he has executed 77 projects across the state in a bid to fulfill his campaign promises. One aspect that concerns him the more is the provision of palliatives to people of the state as the fuel subsidy removal continues to bite harder.
We have no option because our farmlands were destroyed. The means of livelihood of the entire communities were destroyed. So the only way we can do is to provide humanitarian support. This is the cardinal objective of my administration. In addition to providing security, which is number one duty of any administration, my next ambition is to help the vulnerables in the society. Almost everybody is vulnerable in Borno State. It will last for throughout my tenure of the next 4 years.
President described him as a God-sent leader.
So far in the 100 days that have passed, the governor has prioritized a lot of issues in the education sector, in the health sector, and also has contributed a lot to the social development of the state. The Hausa people will say, Ganiya Koriji. So far, so good. The 100 days in office of our governor, Professor Babagana Zulum, has been a lot of achievements.
Another day for residents of Maiduguri to go out in search for their daily bread. They now pay 150 naira per drop against the usual 50 naira due to the removal of fuel subsidy. But all this is about to end. These 70 buses are set to be commissioned by the state governor to ease transportation. He says this is part of his administration's commitment to giving a better life to Borno citizens.
The most important thing is that you have to sustain all these buses, get good drivers, fire out all those drivers that cannot maintain it. Before was very known for its capacity of generating internal generated revenue. You are doing your best, but we shall continue to support you. Most importantly, sustain what you are doing.
The buses are now functional and residents are excited with this development.
100% different. We appreciate the governor of Borno State, Professor Babagana Zulum, for the well done work, more especially for civil servants.
To my surprise, when I'm about to go to school, I saw a bus there near High Court. Then they are even calling me that the motor is 50 naira, which of sometime in the morning when I'm going to work, I used to pay 200, 300 naira to my destination. But to my surprise today, I pay 50 naira. And now I'm returning from my work now, going to Polo again, and I'm paying 50 naira. What I will tell our Oga, that is Professor Babagana Zulum, we are very grateful because of his effort.
30 out of the 70 buses has been dedicated to conveying civil servants to their places of work from 7 a.m. to 9 a.m. in the morning and return them from 3 p.m. to 5 p.m. Mondays. In August 2019, exactly 3 months after the inauguration of the executive governor of Borno State, Professor Babagana Zulum, he assented to a bill establishing the Borno State Contributory Healthcare Management Agency. The pioneer executive secretary, Dr. Saleh Abakaza, young and dedicated person, has been doing a lot in helping the vulnerable people of Borno access to health care through a new program known as the Zulum Special Health Intervention Program. Take a look.
Very important program we are actually promoting, which is the Zulum Special Health Intervention Program. This intervention health program is actually meant for vulnerable citizens of Borno State, and amongst the vulnerable we are concentrating on about 5 categories of vulnerability. One is the pregnant women, children below the age of 5, that is under 5 children. Then we have the people living with disability. We have the elderly people or the aged, and then the poorest of the poor, among others. And then we also have another category, which is actually we used to tag as those people with special needs. These are 5 categories of individuals or vulnerable people that we are actually concentrating. The Zulum Special Health Intervention Program is from His Excellency. Actually, it is out of his own passion towards healthcare that he made this funding available. And from our take-up, he was able to release 100 million to the agency, so that the agency could do some of those activities, including disease activities. And out of this funding is what we have been using for the past 2 years to ensure that those things have been taken care of. And then other sources of funding that we are expecting is actually from the philanthropists, so that they can also key into this program, and then so that we can actually maintain the program from rolling.
So bana da dama zuwa yi, bana iya tashi, bana iya zo na kasuwan ma ya tsaya. Amma inda hali in na samu dan canji, zan iya bude kasuwa din, ko ina zama kasa ma zan iya samu abin da zan ci da yalina. Kaga yalina suna kara su bayan zuwa hakan a kuda. To wata 5 suka zo daga Kolofata, su ma ba su samu abinci ba. Haka suke su. Ina da mata 3, yara na 19.
Yaron ya yi rashin lafiya da dama, kuma yau at least yana asibiti ya kai kwana 40 har yau, kuma yanzu karfinmu ya kare.
For the people, we covered the basic health needs for those people, and in some cases we even go beyond just covering their drugs and then other related hospital bills like their bed fee and other things like that. We even go beyond looking for to source for funds for them, even for their feeding, and because as they stay in hospital, definitely they need to actually feed themselves, and those individuals are people that don't even have transport money to even transport themselves from their houses down to the hospitals. And that's why you see a lot of them cooking within the hospital premises, so that at least they will have something to eat, to give to the patient to eat, and also for them to also eat and other things like that. And it is very, very inconvenient for them. So as such, and then another thing is that those people that usually used to stay that long in hospitals, you find out that even after they are discharged, they end up maybe losing their jobs, or they end up being uprooted from their usual means of livelihood. So before they go, so those people, Sometimes they may need some therapy. It might be occupational therapy. Among the other classes of people that we also identify are those people that are orphans, and those people that we used to call them the unaccompanied children as well. The unaccompanied children is because of a decade-long insurgency. You realize that we have a very large number of population that has been displaced, which was around getting to about 2 million or more in people, including the children. And as such, there are among them those unaccompanied children and those orphans among them, which may also need such intervention. And we also have those people that have mental disabilities. Sometimes you will see a lot of people roaming about the street because of mental illness, and then their families could not be identified or so. So we also intervene in such cases if we identify such individuals, and then we will see how we can even get the care, the necessary care that they needed, and also to help them trace their families. And we do that in collaboration with many stakeholders, including the civil society organizations, not only the government apparatus, but also the private apparatus as well as the...
Sunana Abubakar Muhammad, ina anguwan Budim, yanzu haka ina cikin General Hospital. Da farko zan yi godiya a Boshma wanda ta dauki nauyin in mana aiki na tiyata da sauran magunguna. Na gode masa da ma'aikatansa gaba daya. Kuma a gaskiya yanzu mun samu lafiya, muna ganin aikin da aka yi na yanzu an dace, kuma alhamdulillah yaro ya dan samu lafiya, yana maganansa, yana neman har sauran, yana neman a bashi abinci mai ci.
Rashin kuɗin ne ya sa ba mana aiki da wuri ba, amma to yanzu mun samu an mana tallafi, an taimaka yanzu mun samu aiki. Na gode Allah ya saka wanda ya mana wannan abun, muna mishi godiya sosai.
He's a victim of gunshot injury, where there's some bone loss, and he had multiple fractures on his his left thigh and hip. So he had an initial surgery in Dala where he spent a lot of money, but the fracture did not unite. So he had to come back here. About the third one. So what we are trying to do now is to unite the bone and elongate the bone because the leg is shorter. So we're trying to equalize the length of the left leg so that it will be the same with the opposite one. A lot of things could have happened, as simple as losing to a patient, actually. The elongation is progressing and he's gaining length every day. He's doing very well. He's happy.
Ina godiya ga Allah sarki Ubangiji da bayan da aka yi mana tiyata biyu. Ina godiya yanzu jikina din akwai sauki. Mun aiki da yanzu din akwai bambanci har ina iya soka, ina tatakawa, ina ta adjust din duka akwai sauki alhamdulillah. Baba Umar Zulum, Allah ya sa Ubangiji ya tabbatar mana da alheri. Ina godiya sosai da zuwan da muka haɗu da Boshma da Dr. Salen da ya zo ya hada mu duka gaba daya. Ina murna, ina taya ku godiya.
It's actually very useful, but it's equally very expensive. Orthopedic surgeries are actually very expensive. So this is where this kind of schemes like the contributory healthcare scheme comes into play. And I call on the general public, those that really have the means. There are a lot of such patients outside that could not access this kind of care because of lack of funds. So philanthropists can come in, sponsor such patients. It will go a long way. This is a man that has 3 wives before now, but now he's living in an IDP camp and it's not his making. This can happen to anybody. That is my call actually.
Wannan dai da ya same ni yau shekara guda kenan, daga kaikayin ciwon ido kuma shi kenan sai hazo ya shiga. Da wannan ne yake ciwo kuma wannan ma ya karba ni duk ba na gani gaba daya. To shine zan ce wannan dai sai dai Allah ya saka muku da alkhairi, Allah ya sa race.
Assalamu alaikum, ni da sunana Aisha Ibrahim, mahaifiyata sunanta Rabi Abdullahi. Yau shekara ɗaya baya ba ta da lafiyar ido. Mun zo ganin likita yanzu akan a ga lafiyar idonta, an duba an ce aiki za a yi mata. To an sa hannu akan za a yi mana aikin kyauta. Allah ya saka da alkhairi, mun gode, Allah ya biya, Allah ya taimaka, Allah ya sa a dade ana yi, Allah ya ba ta lafiya ita.
The condition of the patient is cataract blind. And as we all know that cataract is simply a cloudiness of the lens inside the eye, which is supposed to make you see clearly. And one of the most common causes of blindness worldwide is cataract. And blindness due to cataract is reversible, in that by simply extracting that cloudy lens and replacing it with a clear artificial lens, vision is restored. And the aim of taking her for surgery is to restore the vision of the patient. The most common cause of cataract is age-related. That is due to aging. So, because the higher percentage of the cataract blind are the aged ones, and they are not economically productive, actually. And one of the barriers to uptake of going for this procedure, looking for medical attention so that you get your vision restored, one of the barriers is the cost. So most of them cannot afford it. So we're really grateful, we're happy to see that Boschma has intervened this time around to take up the responsibility of the cost so that this patient can have his vision restored.
One major issue that we are facing in Borno State is that we have a larger number of people that are not covered by any health insurance scheme or contributory health scheme. More than 90% of the individuals in Borno State, or even getting to about 95% of the people in Borno State, are not insured by health insurance coverage. And even the registration at the contributory healthcare level is a bit very, very low. So as such, we are using also this medium to sensitize people that taking care of the healthcare, they have to actually change their health-seeking behavior to a very positive one, because health is wealth, and without health we cannot develop. To ensure the smooth operationalization of this program, the agency is working alongside stakeholders, especially the Ministry of Health, which is the mother ministry, and then the State Primary Healthcare Development Agency, as well as the Hospital Management Board. which are responsible for the primary healthcare centers and the secondary healthcare facilities respectively. At the same time, we are also working hand in hand with the Agency for Sustainable Development and then all the other stakeholders, including the civil society organization, development and the humanitarian partners, as well as the philanthropists within the state.
Ina fama da matsalar dialysis ne kaɗan, so kuma gashi na samu an taimaka min mun successfully without any problem. Yes, so actually ana yin sa very expensive teaching hospital and other places. Then our mu ana an yi wannan shi free. State government. Wata wani sun taimaka yake ba ni kaɗai ba da su sun taimaka.
Particularly this our patient Aji Mohammed Kirawa. Is our staff here in this place. That's a state specialist hospital. So he has end-stage renal disease, or what we call kidney disease in general. So, and this kidney disease, ultimately what it means is that the kidney cannot function. That's the normal function that the kidney used to carry out. The kidney cannot do it anymore. So this patient is supposed to be on a supportive treatment, what we call either hemodialysis or peritoneal dialysis, or ultimately a renal transplant. So now what the patient is undergoing now, the patient is undergoing hemodialysis. This hemodialysis is what the kidney is doing, that this hemodialysis machine is doing to the patient. Fortunately, is that the state government has took this therapy or the treatment free of charge. So the patients were not paying a kobo for this particular treatment. Where else, if you can do it somewhere else where they are paying, of which the patient requires at least 2 sessions in a week or more than that. So I think Bochuma is important here, maybe as it is implies that the patient is a staff of state, and Bochuma covers the patients that work in the state.
So this program is also part of the component of the 10-part agenda of His Excellency Professor Babagana Umar Zulum, CON, MNI, FNSC, and at the same time the 25 years development plan of the state, as well as the 10 years strategic development plan.
A package on this episode of Borno Restoration. Thanks for watching. I am Jessie Tafida. See you next time. Bye-bye.